I'm Dr. Mani Jambakar. I'm a surgical oncologist in Santa Fe, New Mexico, who's also passionate about cancer prevention, and I have a large high-risk breast clinic, and I wanted to talk to you guys about this update in Tyrer-Cuzick. Now, I calculate Tyrer-Cuzick all the time in my clinic for my patients because it is one of the most reliable ways of knowing someone's future breast cancer risk. And it includes information like how old someone was when they first got their period, how old they are now, what their family history is. The Tyrer-Cuzick breast cancer risk calculator also asks if patients have had a breast biopsy and what the result was below. It's been well known for a while that for someone who has atypical cells on their biopsy or lobular carcinoma in situ, that they are high risk and should follow with a high risk breast clinic. However, now the Tyrer-Cuzick also includes patients who have had diagnoses like an intraductal papilloma, sclerosing adenosis, usual ductal hyperplasia, and radial scar. The calculator was updated to include these diagnoses because these are things that do slightly increase the risk for a future breast cancer. And I played around with the calculator a little bit, and that small amount sometimes is enough to push someone into the above 20% lifetime risk, which means that they should be followed by a high-risk breast clinic like mine in New Mexico. So if you have had any of these diagnoses, an intraductal papilloma, sclerosing adenosis, usual ductal hyperplasia, or a radial scar, you should ask your primary care provider or OBGYN if you need to be seen by a high-risk breast clinic because you may fall above the 20% risk threshold to need something like breast MRIs. You may be someone who benefits from breast MRIs, which are more sensitive than mammograms for catching breast cancers.